What would draw all of these people into one room, including the health department, Norfolk City Manager, Fire Chief, Police Chief, Customs and Border Protection, and the military?
We're dealing with something that is very frightening to the public.
Ebola. The Ebola outbreak.
Well, today is an exercise discussion, if you will, on the threat of Ebola. So the idea is that we bring all of our partners of Team Norfolk, public, private, not-for-profit, higher education, and military, into the room just so we can make sure that our plans are synchronized, make sure that we have realistic expectations of who's doing what, and that we otherwise come away with a unified plan to approach this threat.
Synchronizing a plan among many entities and reducing any fear residents have about the Ebola virus. Fear that a special Skype guest saw firsthand.
This is David Darg with Operation Blessing, reporting from quarantine.
He spent time in Liberia recently with Operation Blessing in the fight against Ebola.
I had the opportunity to join our teams on several of these distributions where they go out. They're literally going door to door, providing these hand washing stations, providing chlorine and education. And in doing so, are identifying critical case-by-case basis of families in extreme need, families that are in quarantine there in Liberia because they had a family member or a friend die from the disease in their home. Then the family is quarantined for 21 days and is actually stigmatized at that point by the community, not out of malice, but just out of fear.
He returned to Virginia on October 15th and, at the time of this meeting, was in the final day of a 21-day self-imposed home quarantine.
Flew to Brussels, Belgium, and then from Brussels directly to Charlotte, North Carolina, and from Charlotte to Norfolk Airport. And it was right at the time that they were starting to roll out protocols and checks at some of the major airports in the United States. And I wasn't checked at all. It just came right in and straight to Norfolk with no questions asked, no temperatures taken or anything. Fortunately, I'm not a risk. According to the CDC, I'm not even a low risk. I'm a no risk. Didn't come into contact with anyone who had Ebola, so I am no risk. Being in Liberia was a very nerve-wracking experience. I've been to lots of crazy places. I was in Iraq a couple of weeks before my trip to Liberia, and even that wasn't as nuts as being in Liberia itself and being surrounded by all of that anxiety. And that's the biggest takeaway I have, is just the fear on the ground is massive.
That's one of the biggest reasons everyone is here, joining efforts to be on the same page and to calm any fears Norfolk residents may have of Ebola, and to reassure everyone there has not been a single case of Ebola in Norfolk.
There's no confirmed cases in Norfolk. What they should take away from it is that we're more prepared for that. And we're also, again, unifying our plans and making sure that we're telling them what they can do so they can replace any fear they have with knowledge and information.
While Ebola has not shown up in Norfolk, Norfolk's 911 emergency operators and Norfolk Fire Rescue have been pre-screening callers with potential Ebola symptoms since October. Even if there is never a hint of Ebola in Norfolk, the planning and collaboration that is going on here can serve Norfolk in any emergency. You see, this training is part of an all-hazards response plan to natural or man-made emergencies.
It's the same structure, same framework, same relationship, so we take this opportunity to beef up our plans even more.
Which is why everyone here is meeting in the first place, to continually improve Team Norfolk's response to anything that may come up in the Mermaid City.
We're one, we're all together, we're in the same community, so we're going to work together through this hazard.